we have to be investing in communities if we want to really focus on prevention and early prevention. The challenge is the financial return won't happen for several years, could be even generational, particularly when there's some deep-rooted health inequalities and health challenges. I know locally we've made the decision to really invest some of our health inequalities grant in things like asthma, community first approach, because we do know that if we invest now, it's that longer term return, but it's how we demonstrate the impact along the way, and that can be a real challenge. And I think linked to that is something about how we really measure the value. If we're only counting today's savings, we miss the wider economic and patient-person impact. Using measures that capture things like avoided admission, improved independence, or even people's ability to stay in work really helps demonstrate that bigger picture, which I think quite often we view it through the single NHS lens. I mean, we've done some really great work. I say we, my team, have done some really great work around the Know Your Numbers campaign over the last sort of week or so, and that's about checking blood pressure checks. And that is a really good way to be able to demonstrate, just by doing those checks now, the savings that has in the longer term, and there's some really good evidence about that. And I think it's how we can do more of that, where how can we build the evidence to demonstrate that the savings will come in the long term. It's that age-old thing of trying to prove something that's not going to happen, if that makes sense. And then I think, yeah, we've got to be able to align policy with the financial flows. As I said, we need to get more money out into communities, very much that population health approach, and moving away from those single year cycles. Paddy touched on it. It's starting to happen. The annual planning from NHSE and ICB is earlier this year, and it does include that sort of short, medium and long term, as well as the short term. And I think if we can give providers longer contracts, then they have the ability to be more creative and innovative. And I think it's fundamentally about seeing patients as people and not seeing it as today's cost or balance sheet. And I think if we can get some of that right, the economics and the patient outcomes will align. We just need to stop trading today against tomorrow. I think that's one of the biggest challenges in how the NHS currently operates.